Hello everyone, myself Kiran. So today we are discussing the topic that is malaria. So first of all, introduction about the malaria. Malaria is a serious life-threatening disease that spreads through the parasites. It is caused by the malarial parasite that is a plasmodium. It comes with the bite of female Anopheles mosquito which carries this parasite. Basically, malaria is a disease caused by a parasite. The parasite is spread to humans through the bite of infected mosquito. People who have malaria usually very sick with a high fever and shaking chills. Next is the types of malaria. Basically, there are the four types of malaria: Malarium plasmodium, falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. The most dangerous type is the Plasmodium falciparum. It is the most dangerous species rather than the other all the species. Next is the types of malarium. First is the Plasmodium falciparum. It is responsible for the majority of the malaria death globally around. Its most prevalent species is sub-Saharan Africa. Incubation period 12 days. Plasmodium vivax, second most significant species, and it is prevalent in Southeast Asian and Latin America. Incubation period is 14 days. Next is the Plasmodium ovale. It is acute complication of the dormant liver stage which can be reactivated in the absence of mosquito bite. Incubation period 17 days. Next is the Plasmodium malariae. Represent only a small percentage of infection. Incubation period 28 days. Etiology: agent factor caused by for a distinct species, but the Plasmodium vivax is more common. Host factor: agent 6. After all ages, male are more prone. Socio-economic status: more occur in low socio-economic status group and due to poor housing conditions. Population mobility and occupation: people migration cause spreading the disease in one area to another, and people who work in an agriculture occupation are more prone. Environmental factor: maximum prevalence is from July and November, highly humid area, watery area, and rainy season. Modes of transmission: malaria from mother to unborn child by sharing needles to injected drugs through blood transfusion. Next is the transmission cycle. First is uninfected mosquito. A mosquito become infected by the feeding of person who have malaria. Then it transmitted a parasite by mosquito bite. It can transmit malaria parasite to the human being. After that, it infected the liver cells. Once the parasites enter into the body, they travel to the liver, where some types can lie dominant for the years and longs for years. Then it enters into the bloodstream and then infects the RBCs, that is the red blood cells. When the parasites mature, they leave the liver and infected your RBCs. This is when people typically develop malarial symptoms. Next is another healthy mosquito came and bite the infected person, then mosquito become infected. And in this way, cycle of transmission of malaria continue. Next is the pathophysiology. As I told you earlier, people bite from an infected mosquito. Mosquito saliva containing sporozoites injected directly into the bloodstream of the human being. Parasite starts multiplication in the cells. They are rapidly multiply in liver Then it penetrates into the blood cells. Then further it reproduces occur within the RBCs. Then after they enter in the RBCs, they can fastly reproduce their parasites in liver cells. Then the dominant version of parasite is ingested by the another parasite. Further RBC is infected. It, it leads to the dominant versions to the parasite is ingested by the another parasite. Then the signs and symptoms and clinical symptoms are showing in the human being, that is the fever, chills, anemia, and severe nephropathy. Next is the clinical manifestation. Early symptoms is common symptoms is fever, headache, chills, and vomiting. Usually appear 10 to 15 days after a person is infected. If not treated properly, it with effective medicine, malaria can cause severe illness and it often fatal. How malaria presents clinically. Stage 1, cold stage, chills for 15 minutes to 1 hour, caused due to the rupture of the from the host cells. Red cells escape into the blood. Presents with nausea, vomiting, and headache. Stage 2, that is the hot stage. Fever may reach up to 40 degrees Celsius, may last for several hours, start invading newer red cells. Next is the stage 3, that is the sweating stage. Patient starts sweating in this stage. Next is the sign and symptoms of malaria. Systematically have a fever, back pain, diffuse sweating in lungs, there is a dry cough. In muscles, there is a fatigue and acne, ache. In skin, there is a chill, sweating, and in central nervous system, headache is most common in malaria. In spleen, there is an enlargement of the spleen. In stomach, nausea, vomiting, abdominal pain, and in blood, there is a bloody stool present in the stool. Next is a diagnostical evaluation. Mostly there is a microscopy, a thin film test, a thick film test is occur. Next is a serological test. Serologically detect antibodies against the malaria parasites. A rapid diagnostic test, detection of circulating parasites antigen. Next is the management of malaria. Treatment usually consists of medicines that depends upon the type of malarial parasites. First is the anti-malarial medicine, that is a chloroquine. It is the most common medicine which is used in malaria. The dose of the chloroquine is 10 per 100 to 150 mg and 300 mg once a week for the prophylaxis, and 600 mg on first and second day and 300 mg on third day. These are all the antiviral medicine which are used in malaria. Next is how we can prevent how to prevent from malaria. First of all, prevention of the malaria is keep water tanks and water containers tightly covered. Use mosquito repellent sprays, creams, and coils, etc. Wear clothes which cover the body as much as possible. Keep surrounding of house clean. Don't litter garbage. Don't allow water to remain segregate in and around the house. Fill the ditches. Empty the room air coolers and flower vases completely at least once a week. Dispose all containers, trains, and tires. Cover your skin. Wear pants and long sleeve shirts. Tuck in your shirt and tuck pant legs into the socks. Okay. Sleep under a net. Bed nets, particularly those treated with the insecticides such as the permethrin, helps prevent mosquito bite while you are going to sleep. Summary. Today we are discussing introduction, definition, mode of transmission, causes, pathophysiology, clinical manifestation, diagnostic, pollution management, and prevention. References, you can refer this book and Wikipedia for further references. Thank you.